Hi guys, how are you doing? I hope you are doing well and welcome to today's session of learning. How are you? How is your weekend? Mine is okay. Just enjoying my weekend. I'm just indoors and I thought um, why don't I just make a small video to those women who have gone through cesarean section and help them to learn on how to care for the CS scar while you are at home. So yes, so today I just want to give you a few tips. Those women, those ladies wenye wamefanyiwa CS, then now when you are discharged from the hospital, of course your doctor told you, he or she gave you instructions on what to do. So I'm just here to remind you because I know you can forget, because caring for a newborn baby it really needs your time. So sometimes you might end up caring for this young one and you forget about yourself. So I'm just about to remind you what your doctor told you, so that you can continue following those instructions. Because you know what, if you don't take care of that CS scar, it might end up getting an infection and it will take too long to heal. And I know you want it to heal so fast so that you can embark to your routine activities, your daily activities. So today it's just reminding you. So the average stay in the hospital after a CS is 3 to 4 days. If you are okay and your baby is okay, you will be discharged from the hospital and you will go home. So while you are at home, remember, you're the one who is going to take care of this scar, your scar. So you are supposed to take good care of it so that it can heal. Otherwise, if you don't, you may end up getting complications like sepsis will set in, and then those sutures will just, the scar will gape because of infection. You also might end up going in for a secondary closure. So, and those are some of the things I want us to avoid. So what you should do is, number one, remember to take your painkillers, okay? Because you know it's still a fresh wound. That scar is a fresh wound. Remember, the doctor had to do an operation, so he had to go in through 3 or 4 layers to get to the uterus. So remember, now when they close, there's still a wound inside, and also from the outside you can see it on your skin. So you have a fresh wound and it's painful. So remember to take your painkillers as prescribed by your doctor. If your doctor told you to take your painkillers 3 times a day, remember to do that, because that is how your pain is going to be controlled. Because you know, you need to hold your baby, you need to breastfeed your baby, you need to change this baby diapers, clothing, you need to bath this baby, and you can't do all that work if you are in pain. So remember to take your painkillers as prescribed so that you are comfortable and you can be able to take good care of your baby. And then another thing is, get out of bed and ambulate. By this, what do I mean? There are those ladies who, when they go through CS, now they have been discharged from the hospital, and when you get home, maybe you have someone to help you, maybe your mother-in-law, your mother, your sister, your cousin, or even a house help. And then ladies, you find that now ukifika home, you don't want to get out of bed, you don't want to do anything for yourself. Even going to bath is a problem. Okay, so what you are supposed to do is, I encourage you to get out of bed and go for a walk. Ambulate. Ambulation helps you to heal faster. But if you just go and sleep in bed and like assume that you know that surgery was a big deal, you are very sick, you don't want to get out of bed, you don't want to do any activity, no. You are supposed to get out of bed, ambulate around the compound, take a walk, but be careful so that you don't overwork. You are not advised to walk, to go upstairs like twice or thrice. You're supposed to walk like on a flat surface. You are also not advised to walk on a mountain, so you should take just a little walk just around the compound. This helps you to heal faster. And then remember to wash your wound. Remember to clean your wound, that scar. Your doctor will give you an advice. He will give you instructions on how you are going to wipe that scar. If you will be told to wipe it 3 days a day, please do that. And once you wipe it, ensure you keep it dry, because if you leave it wet, then you are that wetness is a media of viral and also bacteria to settle in. So once you wipe your scar, most of the time you will be advised to do it 3 days a day, in the morning, at midday, and also in the evening. So make sure when you wipe your scar, make it dry. Let it dry so that bacteria and also viruses won't set in. Okay, wear loose and comfortable clothes. Okay, your wound is still fresh. Don't get home and start wearing tight jeans because those sutures hazijashikana vizuri. And also avoid tight underwears, because if you wear a tight underwear, then you will feel pain, because remember your abdomen is still painful because of that scar. And then watch out for signs of infection. When you are cleaning your wound during the day, make sure you inspect it so well. And if you notice that you have a discharge like pus, make sure you inform your doctor so that he can help you. And also you are not advised to drive for the first 2 weeks after CS. Okay, avoid driving, avoid exercising, avoid carrying anything that is heavier than your baby, and also avoid sex for 6 good weeks after delivery. Okay, avoid driving, avoid exercise, avoid carrying anything that is heavier than your baby, and also avoid sex for 6 weeks past delivery, so that this will give you enough time to heal before you resume to doing like those normal activities. And then drink plenty of water, eat a lot of fruits and also vegetables to help your wound to heal very, very fast. Okay, so when are you supposed to see a doctor? When to see a doctor? Number one, when you have severe pain that is not going away even on taking painkillers. If you take those painkillers as prescribed by your doctor and still you have severe pain, remember, you will have some discomfort and some mild pain because this scar is still fresh. But if you experience very severe pain that's not going away even when you take painkillers, please go back and report to your doctor. If you have urine leaking, if you have leaking urine, please go back to your doctor because maybe you might have sustained a fistula during childbirth. If you experience heavy vaginal bleeding, it's normal when you have some mild bloodish discharge from your vagina after birth, that is called lochia. But if you experience like heavy vaginal bleeding with clots, okay, that may lead to you changing like more than 4 pads in a day, then you need to go and see your doctor. And also, if you have a foul smelling discharge from the wound, that is maybe pus from your wound, make sure you go back. That means bacteria, there is an infection in that scar. And also, if you experience a cough and shortness of breath, if after going through a CS you start experiencing symptoms like difficulties in breathing and also a cough, please, like this is urgent. It needs urgent medical attention. If you experience difficulties in breathing and also a cough after surgery, very urgent, because you might be having a blood clot in your lungs. We also have, if you experience swelling or pain in your lower leg, if you experience swelling and pain in your lower leg, please rush to the hospital. You might be having a blood clot, that is what we call a DVT. If you experience hotness of the body, then you have a bacterial infection. If you suddenly become sad, depressed, withdrawn, or having feelings of wanting to harm yourself or your baby, okay, have you had, if all of a sudden you start becoming sad, you become withdrawn, you have feelings of harming yourself or harming your baby, you are going into depression, please rush to the hospital and your doctor will help you. Also, if you have a swelling in the hands, on your face, or in your eyes, this is what we call edema, please rush to the hospital. You might be having these ladies who develop high blood pressure after giving birth, okay? So if you experience any puffiness in the face, in the eyes, in your hands, please rush to the hospital for a checkup, okay? Yes, those are some of the few tips on how you should take care of your scar at home so that you get to heal really quick, okay? Yes, so if you have any question, ask me down there in the comment section. And thank you so much for watching this video. Remember to subscribe and see you in the next session of learning.